Welcome, everybody. Pleased that you can join us today for this session on the response of our various institutions to COVID. It's great that you're able to join us, and we have a number of colleagues from across our different universities who are going to give a short background to how we've responded in terms of research during the pandemic. And then we're going to open up for question and answer. So please use the Q&A button to post your questions. They will be collated for us, and the panel will then answer those questions. I'll briefly introduce myself and then ask panel members to do likewise. So my name is Lawrence Young. I'm professor in the medical school at the University of Warwick, and I've always worked on viruses and cancer. So I've been doing quite a bit of work in relation to the pandemic and helping to coordinate some of the university's activities in this area. I have to actually apologize that our colleague Tomas from Gothenburg is unable to join us today, but we do have our other colleagues ready and waiting. So I hand over to Enric for him to introduce himself.
Oh, hello. Thank you very much, Lawrence. My name is Enric Valduvi. I'm Vice Rector for Research at Universitat Pompeu Fabra in Barcelona. And my area of expertise is a bit slightly more removed from the pandemic situation than yours. I'm a linguist, and so viruses are not really at the core of my expertise. But nonetheless, I've been helping a little bit coordinate and being behind all of the initiatives here at UPF.
Okay, thanks, Enric. And then I'll hand over to Igor.
Yep. Thank you. My name is Igor Švab. I'm Dean of the Medical Faculty at the University of Ljubljana, and my main profession is that I'm a GP, so I'm used to solve practical problems on a daily basis, and this epidemic was quite a challenge in that respect. So I was sent here to represent University of Ljubljana.
Thank you very much indeed. I think I don't know if we have a couple of our colleagues going to join us a bit later. I think Dirk's joined us. I can't see him, however, at the moment. So perhaps what we should do is start with a short presentation from myself, and then each of us are going to give either just a verbal update or a short presentation from our different perspectives. And please do use the Q&A button to put any questions in them. So we'll come to those and do our best to answer those afterwards. So I'm going to share my presentation now. Let me just share the screen. And I hope everyone's able to see that. I think one of the things that we've learned at Warwick is the strength of multi and interdisciplinary research in all its forms, and that's something we pride ourselves at being really good at, actually. And the pandemic has really brought this into sharp focus. I'm quickly going to run through a few slides that are mainly focused on how we organize ourselves into interdisciplinary research groupings and how that's powered us and helped mobilize our activities during the pandemic, with a few examples. So we've set up for a number of years now a set of global research priorities which bring together different groups from across all faculties and all departments around these 10 themes. And so even though, like every traditional university, we have a faculty and departmental structure, we have these overarching research area and themes that bring together diverse groups across all faculties. And I think the novelty here is this isn't just about science or arts or social sciences, it's about everybody coming together. And I have the privilege of helping to lead this one here, which is the health theme, which is a very large area, recognizing that even though we have a relatively new medical school at the University of Warwick, it's only 20 years old, we compensate for that by the strength of our interdisciplinary health research. And what we've been able to do, and I won't bore you with too much detail, is bring together this group, which also helps, actually, I have to say, not only with research, but the way we think about training our students across the different faculties. So essentially, it's a grouping for collaborative working. I lead this with a colleague in engineering, and we have these different themes that you can see here. As soon as the pandemic hit, we decided to mobilize the activity across this Warwick Health Global Research Priority, and we're fortunate in being able to persuade the Pro-Vice Chancellor for Research and the Vice Chancellor to give us a little bit of extra funding and to use that to help develop a few streams of activity. I guess the most interesting one from our perspective, and the most important one practically, was working together with our local hospital. We're able to get testing up and running very quickly and to refine some of the testing approaches. And this brought together colleagues not only from my own background in virology, but also chemistry, physics, engineering, and also sort of the analytical side from computer science and mathematics. And again, I won't go into the details here, but not only was this able to support driving the testing, the routine testing, actually very much enabled by our medical students and PhD students, but we're also able to develop some novel approaches as well, particularly the sort of lateral flow devices that are being rolled out at the moment. So this was, again, a measure of the strength of interdisciplinarity. I just wanted to mention too that a lot of what we've been doing nationally is around informing the decisions of our government from an epidemiological perspective. The UK government is using a number of centres around the country to develop different approaches to the epidemiological approach, and we have a very strong group of epidemiologists who have been working both on short-term predictions, looking at the impact and how to better develop contact tracing, and also now modelling how vaccines might help as well as mass community testing with potential exit strategies. So we brought all that together, and I guess the most important thing from my perspective is how we've been able to work productively with our local hospital. So partnering with the NHS trusts where we do most of our medical student training has allowed us to bring together a number of different areas of activity. I know this is difficult to see, but this was something which we're really proud of, because we presented this work recently at a Royal College of Pathologists meeting, and we won the top prize in the country for this. And this is about how you bring together routine diagnostics with some novel things. And one of the things we've been able to do, which has proved very useful, not only for us, but for other collaborators around the place, actually, is the establishment of a biobank specifically dedicated to samples from patients with COVID. And it's allowing us to do some interesting things in conjunction with the vast amount of activity that's going on across the globe. So I just wanted to finish by saying that we know that this has been an amazing thing over the last 10 months. So what I wanted to highlight is the value of interdisciplinary research, including colleagues from the arts faculty and from social sciences, as well as the science and medical departments. I think the structure we have around these global research priorities has proved enormously valuable in being able to rapidly mobilize activities and bring groups together. It's also helped us think about international collaborations in diverse areas. Here I've mentioned some of the work we're doing in mental health in lower middle income countries, some of the work I'm directly involved in terms of testing in Indonesia, and some of our more virological studies in China. But we're trying to broaden that, and I hope from the discussions today that one of the actions will be opportunities for us all to work more closely together during this pandemic, and it's also created interesting opportunities to work with industry and obviously additional funding opportunities. But I think it has demonstrated the power of research, as we all know, given what's happened in 10 months. It's unprecedented, and I think it's going to change the way we do this research forever, actually, and the way we think about international collaborations, working closely with a number of different stakeholders. So I'll finish there. So that's me done. I think what we'll do now is hand over, if it's okay, to Enric. If that's okay, Enric.
Yep, no problem. Yes, definitely. Okay, so I'll share my screen if I may here. Okay, is that all right now? Can everybody see that? Yep. Okay. What I thought I would do with this presentation is go over, how we had to deal with the effects of the pandemic as they came along, and some of the lessons that we learned and some of the things that we did with respect to that. Okay. So at the beginning, the immediate effects were, the a big impact of an unexpected but immediate radical lockdown that basically brought us to a brief standstill where people were mostly disoriented. But then there was a gradual but quick return to lab activity, especially in biomedicine and biotech, for obvious reasons. And as soon as possible, within phase 1, tier 1, small size research gatherings were allowed, preserving all types of health safety measures. The return to activity was slower in behavioral research, experimental research, and in fieldwork activities, because these types of research activities are contact intensive, and therefore they were much more subject to many more constraints. Okay, we had strong restrictions applying to libraries, because as public libraries, they were subject to specific regulations from the government. And then we had to address a number of very specific concerns that affected PhD students as perhaps the weakest tier within the research. The different stages of research, issues that had to do with access, mobility, being stays abroad, deadlines that were expiring in the middle of periods of inactivity, etc. The actions that we took had to basically the overarching goal was to avoid a standstill, while at the same time following all the restrictions set by the authorities. And there was a very quick implementation of all safety procedures, especially in biomedicine, and incremental access to campus facilities as maximally permitted by the restrictions at the time. There was intensive, brilliant work by all the people in research and innovation support, where all the workflows had to be restructured, and everything had to be rethought to accommodate working from home. And what we did, and I think that was very good, was intensify all sorts of communication, either through web, through email, both about the restrictions, health restrictions, safety measures, but also about posting pieces of writing, articles about the impact of coronavirus in different fields. Both UPF and also IS Global, Institute for Global Health, regularly posted news about scientific articles in this area. And that I think was very good in order to keep the community together. More practical things had to do with the provision of alternative workspaces when needed, and specific actions, as I said, for predoctoral researchers, which were the focus of attention of the doctoral school. And then actually a funny side effect of everything was that we intensified all work that had to do with our e-repository and the CRIS, the research information systems. We encourage people to update and work on these things, and we've had an increase in our rates of open access documents, for instance, etc. Okay, so that's an interesting fact. In this fight or whatever, this handling of the pandemics, we participated in a concerted effort by the government of Catalonia to run PCR tests in our biomedicine labs. However, that was aborted because the government preferred to concentrate all of the testing in a smaller set of research centers, more directly connected with to the area of health. Okay. And finally, everything was set up, the robots, everything. But finally, they said, let's not extend this to. We're doing fine with what we're doing. There were a number of both student and faculty initiatives, 3D printing of face shields, design of transparent mask, disinfection methods. We even our School of Engineering even set up a contest, a competition where there was an award for ingenuity against COVID. A specific crowdfunding campaign was organized to help fund COVID-related projects. And a number of applications were submitted to European, Spanish, and Catalan calls in biomedicine and biotechnology, biomedical engineering, and also in the social sciences and the humanities. This is just a quick overview. We've submitted about 45 proposals. 7 of those were successful, and these are the funds obtained for specific projects addressing COVID issues. These 10 proposals for which we have no feedback yet are about a very interesting proposal, call that was put out by the Catalan government with an emphasis on the social sciences and the humanities and their relationship with the pandemics in general, including COVID-19. And this was in the line of what Lawrence mentioned before, propelling interdisciplinary research and how events like pandemics affect societies in a number of, and people in a number of dimensions. This forced people from different departments, from different faculties to collaborate. And in that very same line, and also in the spirit that Lawrence was mentioning in his presentation, we already had this undergoing initiative, which we call planetary well-being, which is by nature interdisciplinary, where people from different fields approach the well-being of the planet from a health perspective, but also from many other perspectives, environmental, social, economic, cultural, etc. And we've actually realized that this was a very good idea that we need to keep on working on. It's running, it's very successfully running. And in fact, I'm very happy to say that recently the universities in EUTOPIA submitted a proposal for a pre-doctoral co-fund where this topic, planetary well-being, was also adopted as an overarching theme to incardinate different research areas. So I hope this is something that will keep on growing. And it's in that very same line that Lawrence pointed out, the importance of doing work across fields and seeing things from a myriad of angles. And that's the way forward. Yeah, so I think I'll stop here. Thanks very much.
Thanks for that, Enric. That was great. Just want to encourage people to put any questions into the Q&A button there, and we'll come back to those afterwards. So please do that. I'll hand over now to, is Patrick there? If Patrick's there, I can't see. Oh, yes, it's Patrick. Hello. You're still mute. You're muted, Patrick.
Sorry.
Oh, Patrick, do you mind just introducing yourself and then presenting in whatever way you decide is best? Thank you very much indeed.
Patrick Courilleau, I am the Vice President of Education in CY University. I present you all the university during the health crisis, the university first thought about its students and staff. It was necessary to protect fragile personnel and pay particular attention to personnel who were no longer in a position to carry out their mission because they needed to be on site. On the educational side, the first difficulty was to provide the tools for distance education. This required us to develop our digital platform to support a greater load. We also had the opportunity to be able to offer access for some logiciels like Office 365 tools to all of our staff and our students, in particular to use Teams. We had just established an educational engineering service, which was able to offer assistance to the teaching community for the appropriation of these tools. The crisis, in this sense, has been an accelerator for the discovery of these tools and this service. But this shift to a distance has often been experienced with some suffering. This unrest was reinforced by the organization of remote examinations. It required a rethinking of the assessment method for mastering the expected skills. We had initiated a shift to the skill-based approach, but this sudden shift disrupted a large part of our community. Finally, the crisis has forced us to study the role that we can play in the social fracture of our students. Repatriation problem, housing problem, loss of student job, and especially the possibility of doing an internship. Here again, we were lucky to be able to rely on a new system that was set up in France 2 years ago with new recipes for the deployment of student life. Our university health service has listened to students in psychological distress. We have maintained individual monitoring of our students with disabilities. On the other side, we participate in the collective effort through our Fab Labs. We've made it possible to make visitors. Our Hermes laboratory has participated in a research work on rapid screening methods. We are now facing the second wave. Despite a feeling of exhaustion following the implementations of responses to the first confinement, the return to distancing was better experienced with the possibility of maintaining the practicals and face-to-face exam, and thus being able to provide more appropriate educational responses. On the other hand, we have more students reporting social distress this fall. While we can provide some one-off assistance, region, department, to bridge a digital divide or an emergency situations, we remain helpless in the face of situations that cannot be resolved until the crisis has completely passed. The crisis has thus led us to new ways of working. Virtual meetings and gatherings like today become natural. It made it possible to better identify the times when face-to-face attendance is essential. There is still a lack of perspective on the impact of daily life on family needs when a place of work and daily life merge. More than on the hybridization that one would expect within pedagogy, we have turned more to multimodal education. However, this allows us to move forward on our competency-based approach project, but also on more global vision of the citizen of tomorrow that our students can become. Thank you.
Thank you, Patrick. That's great. Shall we hand over now to Dirk, if you're there? Yes, you are. Dirk, if you don't mind unmuting and introducing yourself and then giving your presentation. Thank you so much.
Okay, thank you very much for the kind invitation to participate today. I'm the Dean of the Faculty of Medicine and Pharmacy of the Vrije Universiteit Brussels. So that's the Dutch-speaking part of the Free University of Brussels. And as my colleague from Ljubljana, I'm also a general practitioner. So I'm very happy to see that we are both GPs. I started working first on epidemiology in our National Institute for Public Health before I became a professor at VUB. But I still work also as a GP at this moment. And it's very strange that my first publication ever was on viruses, on hepatitis B at that time, because coronaviruses were not that popular at that time. But today my work is mainly fixed on coronaviruses. So, I will give you a short presentation of the work and research mainly that we are doing now at our university. I just tried to find my presentation and I will open it. It must be this one. No, I don't know what you're seeing now, but
we're just seeing something that says local information.
ah, okay, but then I have to go back. Okay, but I understand where we are now. So this is now you see the start of the presentation. Yes?
Yes, that's fine. Thank you.
Okay, so excuse me for this. First telling that we have two main campuses in Brussels, one in Etterbeek with 20,000 students, but the medical students are on the campus in Jette, and there you have our university hospital, and really behind that university hospital you have the medical campus with 3,000 students. Now, first of all, there's a very close link between our faculty and the university hospital, and especially on the research. We have in total 54 research projects which are running at this time, but we have also only 30 projects which are starting up at this moment, but this 54 projects are also in the slideshow, but I will not discuss them all, but I will highlight some of them. Now, the collaboration is very close with our university hospital, and the funding was gathered from our university itself, but also from the government, where some funds raised, and also from industry. There was also a collaboration with industry, not only with the pharmaceutical industry, which is very normal, but also with, for example, auto builders like, or car builders like Audi and Bosch for wiper motors. I will explain you later why. Now, the expertise, because we produce a lot, but we produced also a lot of expertise for the government and for the hospital, and especially with the mathematical models, which were useful for the government to predict the need for hospitals, but also for primary care it was important, and for the local governments. I will give you some examples. For example, very in the beginning, we didn't have any protection material, especially not in hospitals, and we built some protection masks for our nurses and doctors in the hospital with diving masks. Now, this was done in many countries, but we had the help of our engineer department at the faculty at or the campus at Etterbeek. So there was a very narrow collaboration with them. Also with these engineers, we produced some respirators, and we used therefore these motors from wipers from Bosch that we received from the Audi car construction in Brussels. We were also very strong, and it's my colleague and collaborator, Kurt Barbet, who made the mathematical models for Belgium. And as you see, this is a very recent mathematical model where we can predict the number of hospitalizations at one side and the number of ICU hospitalizations at the other side over time. And so now we have a very narrow confidence interval, but when we were at this stage, I can assure you that the confidence interval was much broader. Local information also, I don't have a picture of this, but for example, for local authorities, we had, for every commune, we had the figures, and we made them very clear because these figures are available from our National Institute of Public Health, that's Cienzano, but we made them very accessible for the local authorities so that they could see the situation in their city or commune, but also see the evolution. And it was very important to detect very early some local infections. Now, when we have but I don't have time enough to take a look at all this, but we were also active in vaccine research, also in T-cell response. There was a very important research, diagnostic methods in collaboration with the university hospital. A lot of drugs were tested, not only on their working, but also on the side effects. It was necessary to test them. You see, it's a very broad panel of research that we have with also our engineers. Special focus also on the pregnancy during Corona. So this is more we made also an online Corona test for the citizens of Belgium, where they could test themselves with a questionnaire, and then knowing if they should be tested with a PCR test or not. We had a knowledge bank, which was developed only in Dutch, and then also on work and welfare. The contribution of the engineers with robotics, the face masks were built. Also, the ICT collaboration was important. I will just pick up some other things. Also, the psychological and social aspect was had some research. For example, the experience of healthcare providers with dying patients was important, and also the mental health in times of Corona was subject of research. Also, the mental aspect in children was researched. So this is just an overview of all these research. But if people are interested in some research topics in particular, I'm very open to give you more information. So thank you very much. I will stop the sharing now. Yeah.
Thank you, Dirk. That was really comprehensive and really interesting. I can see lots of synergies actually, and something no doubt we're going to come on to discuss is how we might exploit the synergies between our different institutions, because we're doing lots of very similar things, but we have diverse and complementary expertise. So this is something we need to think about. Okay, Igor, it's over to you now.
Yep, thank you. I'm not having a presentation, so I'll just speak to you. Slovenia has been affected, as all European countries, with the COVID-19 pandemics. We were a bit late in getting into the first wave, but we started the lockdown on March the 13th, where practically all education was stopped and moved online. Research laboratories were practically closed for a month. During that time, researchers worked online from home, and they could concentrate on study of literature, data analysis, writing documents, reports, and so on, but not on practical work. Then we had also problems with PhD students and people finishing their PhD thesis, and had to adapt accordingly to allow them to finish in time. One of the areas that has probably suffered most is research projects in the humanistic field, where they were supposed to use the methodology of personal interviewing, which was not possible. So this had to be either postponed or changed to another method. There is one exception to the general rule, that is the laboratories of microbiology were, of course, working at full speed and had to increase their capacities quite a lot. Our microbiology institute provided more than 50% of all PCR testings for the country. So they had to increase their work a lot, which meant that they were faced with tremendous logistical problems, which we managed to solve somehow. One of the interesting things from Slovenia for the partnership is that since we are a small country, University of Ljubljana practically provided most of the scientific background for policy decisions at the national level. Our professors were heads of committees that were proposing measures to the government, that were, and all the other things. In that way, this has proven to be quite successful. We also had some generic problems, like delivery of research equipment could not be done in time due to either logistic problems or because production was moved to other areas. There were problems in the delivery of equipment for laboratory testing, which we managed to solve. So this is, we were not faced with a quite serious issue of not having enough capacity to do the testing. One of the factors we were also faced with was that we had to, all the international travels and all the international meetings were closed. So a lot of them had to be canceled and postponed. And but luckily we have managed to use internet or other methods of communication, so this has proven quite successful. During the summer months, we went out of lockdown. Slovenia, I think, was the first country in Europe to officially declare the end of an epidemic, which was a stupid move from our prime minister, but it was a politically very successful. So, you know, and now we are in the second wave, which is quite heavy. We are again forced to work predominantly online, facing more or less the same limitations that we had in the first wave and building on the experiences we have had. So the only teaching that is done face-to-face is clinical teaching for medical students, and we are in constant negotiations with policymakers to allow this to still to take place. Online conferences and meetings have become the norm of sharing knowledge, and I must say that results are better than we have feared. So this is one of the successful messages. And but to me, the best message is from the students, that they are doing tremendous things as involuntary work, helping patients, working in homes for the elderly, providing information through a national clearinghouse for the whole population. And this is perhaps the most pleasant surprise we have received during this pandemic. So that's my short report for you. Thank you.
Thank you, Enrique. I think what this demonstrates is the incredible, the incredible diversity of activity across our universities and the richness of that activity. I think it would be an enormously wasted opportunity if we didn't think constructively about how we might connect some of these activities and think about how we might share better our experiences and think about what this might mean for the future of the way that we engage with each other. So I think it's incredible the way that all this activity has been mobilized, and it would be wasteful if we didn't think about what this means for our future engagement. Okay, so please put any questions in the question and answer button, and these are being collated for us. So colleagues, if you'd like to see, if you can click on the Q&A, you can see we have a question from Elisa de Potter from VUB, who wants to ask us about our opinion on the current lack of a clear European approach to the COVID-19 crisis. National governments are currently in charge of issuing measures on restricting the spread of COVID-19. Do we think this should be coordinated more at European level? Do we have any words for our European policymakers regarding the response? Who would like to pick up on that one? It's obviously quite controversial, but would anybody like to, any colleagues like to comment? Please unmute. I think the panel can keep their microphones unmuted for this session now as we answer some questions. So would anybody like to comment on the issue of engagement with European policymakers and the need for a more coordinated response? No, okay. I mean, I can start by saying that one of the concerns I think we've had, and what this pandemic has highlighted for us in the United Kingdom is a fundamental issue we have about about public health infrastructure within the United Kingdom. I myself, from my background, have known for years that the public health infrastructure had been somewhat eroded, that in terms of virology, that was a significant problem. And this has come back to haunt us, I think, over this period of time. So I think nationally, we've got a real issue. And we already know that the government is thinking very hard in the UK about the reforming and restructuring the public health infrastructure, as well as what this means for public health messaging, for the fact that we didn't have a diagnostic capacity within the UK. And we have looked out, I think, and continue to look to colleagues in Europe to compare and contrast why we have performed quite poorly. If you look at sadly at our rates of infection and of hospitalizations and deaths, and I think there is an interesting comparison there. But and as we were discussing offline earlier, there have been some interesting issues around border controls and the spread of virus, and the fact that different countries have adopted different approaches at different times. So there has been a significant lack of coordination, but I guess it's understandable during the crisis. Any other comments?
Well, just I think it would be nice to look at the reasons why certain countries had a more resilient healthcare system that coped better with the COVID-19 pandemic than the others. What are the key factors behind it? Because then this could affect policymakers and their decisions. Obviously, the restrictions you impose on the population are quite often culturally based, and it's very difficult to say, you know, Scandinavian people obey the rules. In the Balkans, the rules are there to be, you know, to do, you know, we're just not used to. We're just looking for ways how to avoid certain recommendations. So there are different cultural aspects. So that perhaps may not be an issue, but the issues regarding the healthcare system may be the ones that would be relevant for the whole of Europe.
Yeah. Any other comments?
No, but I mean, I wouldn't, if I may, I wouldn't dare offer any advice to you know, European politicians and leaders because, you know, I wouldn't want to be in their place to begin with. And it's everybody has more or less made the similar mistakes. Things, you know, some people talk about New Zealand, but you know, that's not really easy to extrapolate to the European context. Similar mistakes are being made in the United States and in other parts of the world. So I'm not going to say anything about that. But one thing that is clear to me out of this, as Vice Rector for Research at a public university, is that you know, policymakers, decision makers, they should not neglect funding either for health or for research and education, because when things like this happen, what we need is an educated public. We need our researchers and our universities and research centers to be ready to react, you know, right away on the spot. And we need our hospitals and our general practitioners and our health sector, you know, to be up to snuff, you know, really ready to react. So this should be obvious investment areas for the future, and I think that's one lesson that the pandemic has taught us. I don't know whether it will be learned by the decision makers who are always worried about what's going to happen 4 years down the line, you know, the next election. But I think that's the lesson, a clear lesson.
Yeah. Any other comments? A comparison that's made, I don't know if this is fair, is with Germany, because I look at that and think about the way that Germany responded and ask questions why. One issue for them is they have even though they have that federated system, they have surprisingly, their public health infrastructure is much more functional. They have a centralized institute, the Robert Koch Institute in Berlin, a centralized hub, if you like, which allowed them to rapidly develop diagnostics in collaboration with what is quite a well-developed pharma company set up, which collaborates very well with the hospitals and with the universities. And you do wonder whether that contributed. But I guess not only do we have to consider, you know, all the issues around testing and tracing and restrictions, we have to think about what is this going to mean for the rollout of a vaccine, and how do you implement the right type of the infrastructure required to effectively vaccinate most of your population. I think this is going to be yet another another challenge where I guess there'll be different approaches across Europe, but it's something again we need to consider, and it is so dependent on the nature of your healthcare structure within the country. But I agree, Enrique. It's not for us advising government. I also think they've been stuck between a rock and a hard place. How do you react to something that is completely out of the ordinary? I mean, it's just unbelievably. You can't imagine anything like this at all, and it just hit us. And I also think perhaps we were also too complacent about all of this. Really, there was that interesting TED talk from Bill Gates 5 or 6 years ago, which sort of predicted that this would happen, but nobody really took notice.
Yeah, if I may be perhaps too personal, but within my family there are people that work in the health sector, people who have small businesses, small companies, and their perspectives on the crisis are completely different.
Yeah.
So I cannot imagine what it would be to juggle all of those concerns at the national or European level. So
any other comments on this sort of broad issue, Dirk?
Yes, I think we missed with Europe and with the collaboration, especially between countries and universities, that we missed a lot of chances to fight the virus more or better. For example, every country was searching to an evidence on preventive measures, on wearing masks, and there were in all countries were different kinds of wearing masks. Also on lockdowns, we had different measures in different countries, although that it should be, or the impact of these lockdown or other preventive measures should be the same. We still have a problem now on evidence on the treatment. Even we do not know exactly what kind of treatment should be given. And I know there are big European studies at this moment, but it is unbelievable that now we are 11 months further, or almost 12 months further, that we don't have a good insight in the treatment at this stage. But the most important thing where research should be done is on a diagnostic test, which you can use to detect infectious people. Because at this moment, we still use the PCR test, but your PCR test can stay positive after several months, even after the infection. So I think there are a lot of opportunities to collaborate together, because it's quite clear that these are all questions for all universities, for all countries, but we should put our efforts together to give answers to these questions.
I think that's a really important point. I mean, at the moment, the government in the UK are rolling out community testing based on lateral flow devices, and this is antigen testing. So it's actually detecting, if you like, virus particles. But of course, that probably better detects infectious particles compared to PCR, but it's not very sensitive. So the degree to which you can actually detect asymptomatic. But the point is here, there should be some mechanism for saying, well, what is everybody doing? And let's do some comparing and contrasting. And that's certainly gone on, I think, with serological tests, where a number of different public health activities across Europe have compared and validated serological testing. But I think everybody's been so focused on trying to deal with inevitably with their own national concerns and issues. But the hope will be that once, I keep saying this, once the dust settles, I don't know when that's going to happen, that we should really think about how we can compare activities and think about how we can certainly share better. So we've got a couple more questions. I think one of them is just a point from a colleague around education and what we can do to think about how all of this impacts on the health education. Of course, that is a really important issue for the way that our students can actually learn from this response and think about how we prepare better in the future. And that's also a question from a colleague at UPF around contingency planning for unimagined crisis should be prepared by governments in cooperation with research institutes. Yeah, it's tricky. I mean, I think the controversial thing in this country has been that our government have always said they're following the science, but actually they're following the science when it suits them to follow the science. But we can understand that politically, these are very difficult decisions. And the bottom line is, I think the phrase that's used here is that scientists and experts advise and government ministers decide. And there's a big difference between advising and deciding, I think. And I think, as Enric said earlier, who'd want to be in their position? Any quick questions? Anything else? Any other comments? Because we're just about to finish. If not, I want to thank colleagues for their contributions today. It's been a useful discussion. It's demonstrated the diversity and breadth of activity across our different institutions. And I hope it's also reinforced the value of EUTOPIA and will provide opportunities for us to work together in the future. Certainly, this pandemic has highlighted the breadth of activities, and I think we must really capitalize on that as a group and see whether it's possible for us to work more together in these different areas. So thank you for your time. Thank you for everybody that's attended today, and enjoy the rest of the EUTOPIA week, which goes on for the rest of today and culminates in the closing ceremony, I think, at the end of the day. So thank you again, everybody.
Thank you. Thank you.
Nice to meet everybody. Hope to meet again under better circumstances.
Meet again. Yes.
So thank you very much.
Together.